One of the critical factors that I identified early on when I started doing this was the line of dialogue and the level of communication between the nurse's aide and the patient. It's key. And the reason it's so important is because if they're not on the same page and they're not able to communicate, then the aide doesn't know what the patient needs and the patient is not getting from the aide what he or she needs. And so what we try to do is we try to match up the aides to the patients to make sure that the communication lines are open. Most of our patients, because they're seniors, present with some sort of hearing deficit. And so we want to make sure that the aide is speaking up loudly, they're audible, their dialogue is clear, and we always do a test run with the patient and the aide to make sure that they understand each other. And I can't tell you how many future problems that avoids when we're able to nip that in the bud early on in the process. Throughout the years, Advocate has made a difference in a lot of people's lives. From the day that I started this business and from the day that I can think of that I opened up my first case and I walked into somebody's home and I introduced the nurse's aide until last night, literally. We've done it always with nothing but heart. Heart means everything. Building that relationship with our patients, between the nurse's aides, between the children. A lot of our children live and families live out of state, and so me and some of our other staff in the office kind of become like the surrogate children on the ground. And whether it's been watching our nurse's aide walk out of the house and watching someone get up, not use the walker and walk off because we've been there throughout the rehabilitative process, or in instances where I've sat on the edge of somebody's bed and held their hand as they've passed on. We're there for them every step of the way. And that's the kind of personal service that we try to bring to each and every single one of our patients. We are very proud at Advocate not only to be licensed by the state of Florida, but to have a whole host of different accreditations, starting with obviously the licensing arm of the state of Florida, the Agency for Healthcare Administration, AHCA. We also took it a step further and got licensed and accredited by CHAP, which is the Community Healthcare Accreditation Program. In addition to those two agencies, we're also members, very proud members of the Greater Fort Lauderdale Chamber of Commerce. In fact, we're trustees in that organization. We are also licensed by the Florida Home Care Association, accredited by that organization. And most of all, and what I'm very proud of is that we are actually, by the state of Florida, a licensed home health agency. We're not a nurse's registry. And what that allows us to do is provide a higher level of care and supervision for our patients. So we're very proud of all those accreditations and licenses. Home care is really an alternative. It's an alternative that allows a loved one, when being discharged from a hospital, a nursing home, or a rehabilitation center, to go home and receive the appropriate medical care that they need. Everything from bathing, dressing, transfers, meals, medication. Essentially everything that they need within the home is exactly what we're there to provide.